All right, well, I wanted to take a moment and talk about the Church Acrostic. It's come up in a lot of our modules. It is designed to encourage people to become participatory, to engage. And anybody can do these 6 letters of church. Now, just to bring it up at the beginning, the first C is care for the sick, and H is help with medications. U is unleashing volunteers, unleashing the church. R is an important one, remove stigma. How do we get stigma out of this? The second C is championing healthy behavior, any healthy behavior.
Right.
And H, the last H, is handle testing.
Right.
Now, I wanted to bring these up, and the first step, you have your primary example, which is HIV/AIDS. That's where we've applied this acrostic first.
Right.
But you mentioned to me that we really want to be able to expand this to anything.
That's correct.
So the Church Acrostic, let's start with the first one, care for the sick. Tell us a little bit about how that applied using HIV/AIDS or any example that you can think of.
Right. I think we are dealing here with the church doing the church. And as you just defined it very well, the first C, which is care for the sick, is to, the idea is to equip the church with the basic resources that allows the local church to care for those who are sick among the members of the community. And this can be anything that can be done by whether someone who has a high level of education or someone who hasn't been to school, at school, learn medicine or nursing. So you have under this the support groups where people, and the example here would be with HIV/AIDS, are organized in groups to discuss their daily issues while living with HIV/AIDS, just to mention the example of HIV/AIDS here. So the feeding program actually
Really good example.
falls under the care for the sick.
Right.
And everyone, every church member, once mobilized and envisioned, can do the feeding program.
It's interesting. What does it take to care? Anybody can care.
Exactly.
It's something where you mentioned the feeding program. It's not medicine. It's cooking. It's reaching out your hand and helping someone.
Yeah.
So I do think there's the early educational component. Define care for the sick as it relates to this particular opportunity. Well, it's the feeding program. It's the extra trainings. It's the small group.
Right.
We have resources for that. But if you have that passion, care for the sick, come on board. Participate.
Exactly.
So how about help with medications? Because that could be very specific, but I think we can make it more general as well.
Right. The example here would be, again, with HIV/AIDS. And we mentioned the importance of taking well your medication when you live with HIV/AIDS, as that allows you to reach the goals of the treatment, lower the viral load, and increase the number of CD4, and decrease the risk for opportunistic infections. So that passes by a good adherence on the medication, on the treatment, and compliance to the whole program. And the example here would be, what I personally noticed is that some of the patients couldn't take well their medication for many reasons and needed someone to support them. And we call these treatment guardians. Or, people who would remind them how that it's time to take their medication and encourage them as they take their medication, or even volunteer to go to the clinic, take their medication from the pharmacy and bring them home, and make sure they don't fall into stock rupture. So, and everyone can do that.
It's the idea. You're going to see a theme here, I think.
Right.
The idea, help with meds. I remember patients that were either they were bedbound or they had to work, therefore someone else would go get the medications for them, or they needed a ride. Help with medications, think just in general.
Right.
How can we help these people, not even for just communicable diseases, but the blood pressure medications, any of the non-communicable as well.
Right.
it's developing the habits and helping people develop those habits
Right.
to live a healthy lifestyle and take their medications. One of the more general pieces is unleashing the church volunteers.
Right.
We want to engage more. That's been more of a general theme of what we've been talking about. In your view, maybe again with HIV/AIDS taking in that role, what was this unleashing this group of volunteers from the church?
Again, is the church solving a problem here just by being the church and doing the church? And we mentioned earlier the limited number of healthcare resources and 3 hospitals surrounded by 720 local churches.
Right.
When referring here to the Karongi district in the western province of Rwanda, and with a number of, there are small churches, but there are also mega churches, and with people ready to serve, willing to serve, all they need is being mobilized. And the church is good, is ready, can do that. And these are people who would wake up in the morning with no call, go to the church, give offerings, and be asked to kneel down for a prayer and do so. So the same people are ready to be told and encouraged to serve.
And I think this serving is really the key. A lot of people are church members.
Right.
But what's that action step? What can we do?
Right.
There's this enabling this ability to participate in care for the sick,
Right.
or for really any of the peace works, those letters of peace.
Right.
So I think the primary goal, one of the first goals to go after, is getting those people to feel like I can take action, I can take ownership.
Right.
That's unleashing that latent body.
Right.
So fascinating.
It is the church remains the biggest source of volunteers. It's the most spread organization you can find everywhere in the world. It's the biggest source of volunteers, and all they need is to be asked to do that, to be mobilized.
Have a process.
Exactly.
Have an acrostic. Now,
That's correct.
so one of the dearest ones for me, I think, is removing stigma.
Right.
And I think the church in particular, this is a role that we need to play. Talk about removing stigma and what that meant in the Karongi district.
That's a very good question, and I'm sorry I have to come back to HIV/AIDS all the time to explain this.
Those are big one, yeah.
It's one of the big issues, and that's the case in many other countries, unfortunately. But we take the example of HIV/AIDS, and in a church context where it is conceived as if it was a sin. So one gets infected with HIV by committing a sin. And which means if you've been diagnosed, you've seen as someone who has not been doing well spiritually, talking, and there is a certain ignorance that one can get infected with HIV in different ways, and without playing really a role in getting infected. So, which becomes a barrier or an obstacle to seeking testing and care and treatment. And that way, many people are likely to be living with HIV/AIDS for a long time until they get severely sick. They won't know that they are infected. So the stigma that surrounds HIV/AIDS is a problem. And the church played a role in removing that stigma from the time the church itself starts talking about HIV/AIDS in the community and in the church. Pastors, after getting the basic knowledge on how one can get infected with HIV/AIDS and what can be done to get diagnosed earlier, what's the benefits of getting into the care and treatment program, HIV/AIDS becomes a common topic of discussion within the church and in the community. And what we started noticing in Karongi district is that it was no longer an issue or a taboo, but a problem that is being taken seriously by the church, not in terms of isolating or pushing back those who are infected or finger pointing those who go for testing as people suspecting themselves for having committed a sin.
We didn't do that anymore.
Yeah, so people started feeling themselves comfortable to go for voluntary counseling and testing. And then the church started organizing or initiating the screening themselves, which all of a sudden, removed and the stigma that was surrounding HIV/AIDS, and the numbers are speak for themselves in terms of what was observed in terms of the increase of the use of voluntary counseling and testing services.
Interesting.
Yeah.
It's the stigma that we talk about HIV, one of those, or the global giants, pandemic disease, HIV being a good example. The need to get rid of the stigma, to educate, to not fight shadows. You need to know what you're up against and engage the audience. I think a lot of people in the membership of these churches recognize it as a community problem.
Right.
We need to address this, and the church took that need on.
Right.
And removing that stigma, those conversations become regular conversations in the church.
Right.
So again, anybody can do this. In fact, everybody should do this.
Absolutely.
And it's changing the culture a bit of how do we go after these things? How do we really affect change in our community?
Right.
By the church.
Right.
So good.
And if you don't mind, Dr. Bell,
Sure, please.
because this is a very important topic here, and talking about stigma, the other impact on the whole care and treatment process is that even the adherence that I was talking about, many people, and that's have been observed by myself, and it's well documented that stigma affects the adherence on treatment.
Sure, absolutely.
And some of the patients will not take their medication in front of people who would be wondering why is he taking the medication? Why did the person take the medication at specific time every day? So by the church using its power and resources to remove stigma, and that has worked. At least for the example of Karongi district in Rwanda, we start seeing not only an increase in the number of people using the testing and counseling service, but also the adherence on medication and the improvement of the outcome of the treatment. And of course, that also passes by what we earlier discussed, the support groups that are initiated, which fall under the care for the sick, but also under the help with medication. So it's a very, very important component, and the church can do it.
With all that being said, the second C is champion healthy behavior.
Right.
And I think we've touched on that a little bit already, because all of this relates to that adherence and compliance and not having any guilt with the disease, but you are taking action. Did you notice any other championing physical or healthy behaviors? What were they, maybe, again, within HIV or healthy behaviors just in general in the church?
Right. Yeah, healthy behavior. Now, I have to say that the church has been doing, has been championing healthy behavior from years, But talking about some of the conditions specifically, like HIV/AIDS or malaria or waterborne diseases that passes by a good hygiene. One of the things I would mention here is the a positive prevention or prevention with the positive, how do you help those living with HIV/AIDS to, to not keep spreading the virus? The support groups also actually, some of the topics discussed in support groups include how do you live positively and not spread the virus. When you take well your medication, it's a behavior that is healthy and that prevents you from spreading the condition. So when you you follow all the advice you get at the clinic on your healthy life once living with HIV/AIDS, and you hear or you learn more about that in the support groups at the church or during the home visits by church volunteers. So all of that falls under the championing healthy behavior. Now, in addition to these other lessons, when I talk about malaria and removing water around the house or stagnant water around the house, and hygiene, and how to wash your hands properly, all of those are behaviors that are being championed by the church, whether it is some church volunteers that have been trained or who have specific skills, nurses, giving topics in support groups, whether it's layer level church volunteers who have been trained in hygiene and who are visiting homes and who are teaching members of the community how to follow or respect basic hygienic
Live a
measures.
healthy life.
It's championing healthy behavior. And
You do mention the Clean Water Initiative is a very good example of this healthy behavior. They have a whole curriculum that they do. Immunizations. Healthy behavior can be a very general topic.
Right.
And I wouldn't be bashful with that. But there are many decisions we make that are either healthy or unhealthy in what we eat and what we do.
Right.
So this is the church taking on what is a good, healthy behavior from the church, from a perspective of spiritually, physically, emotionally.
Right.
So good.
Right.
Last one, handle testing. Seems rather specific when we think about some of these other ones.
Right.
Why would the church handle testing?
Very good question. And
I try.
And one would want to hear, do they have needles to draw blood? And pastors are not trained how to do the testing. But again, here it's important to understand that the handle testing here is kind of a broad term that includes even mobilizing church volunteers themselves, but also other members of the community and of the church to go for testing is also under the handling testing. And one of the things that the church was able to do in Rwanda was the church initiated testing, not only for HIV/AIDS, but for diabetes, for blood pressure, and it is possible because it worked and helped to do an early diagnosis of these conditions among many members of the community, and of course this time when it's done at the church level, that's what we call the church initiated and based testing. It's conducted in partnership with people coming from the secondary level that we mentioned earlier, who reach people at the church level.
Come back to the primary level, right?
Come back to the primary level and meet people who have been mobilized by the church at the primary level and conduct the testing there. When we know that one of the obstacles and the challenges we mentioned, we said something about some of the residents who have to walk for 2 to 3 days to reach the nearest clinic. And if one is going there just for blood pressure testing, and
They're not going to go that far.
they won't go there
Right.
for that because they're not having any symptoms, which doesn't mean necessarily that they're not sick. But and it's going to be hard to mobilize a community of 5,000 people to walk for 2-3 days just to have their blood pressure done. While it's easier to invite a team of 5 nurses to come to the clinic and mobilize the church members, and that is after they have understood that it's a spiritual obligation to get screened and know how they are doing as far as their health is concerned, and have them tested in the church.
I hope you can sense the passion from Dr. Poi Poi. We love doing this,
Yeah.
and and it's always so much fun to talk to you about this. The handle testing, for me, one thing that's interesting is many of you who may be watching are used to having a health day or health screening, but it's an event that's just put on. What I would encourage is to consider the church through the Church Acrostic is a community center.
Right.
It is the home for hundreds of people, and there's 700 of these churches in the Western Coronia District. The idea of bringing all these people out and having the church be the center of this work has remarkable value for the community, and it is a safe place to talk about communicable and non-communicable diseases, to get tested, to get screened. And now that this church has been prepared, it's gone through Purpose Driven, it's done some of these church-initiated programs, going to the next level and inviting the clinics to come out. The clinics didn't ask to come out. We asked them to come out.
That's correct.
Or the local church
The
did.
church did,
Yeah,
yeah.
exactly. So the local church has taken on the role as an advocate for their community.
Right.
And I think the handle testing piece has particular value there because a lot of these folks they have to work. They're not going to go just for a blood pressure cuff check.
Right.
The church has become the advocate for them. So
Right.
Anyway, so
And the center to do gets Jesus' holistic mission. And this is the church feeling and proud of doing both the spiritual and the physical, components of the health. And that's the holistic health as it has been taught by Jesus Christ.
it's fantastic. The Church Acrostic. Thank you very much for taking the time.
Not a problem. Thank you very much for having me.